Good afternoon. My name is Dr. Carlos Perez, welcoming you to Nova Southeastern University. We have a very important topic today, continued on the topic of COVID and schools with Dr. Scott Poland. Dr. Poland, I'm going to turn off my camera and let you introduce yourself, and I'll run your polls on your command.
Well, first of all, I want to thank everybody for tuning in today. It's a very difficult, unprecedented time. Schools all around the country are starting to reopen physically, but not necessarily everywhere. And in the last just week or so, I've interacted with school personnel in Florida, Maine, New York, California, and Kentucky. And everybody is not exactly doing the same thing, but everybody is faced with lots of fear and uncertainty. So Dr. Perez, let's look at our poll questions. We really want to know, are you viewing the webinar today primarily as a school staff member, a student, a parent, maybe a community mental health professional? Or maybe a school administrator. It looks like the biggest members of our webinar today are school staff members and mental health professionals.
We're just having a little problem with our poll. There you go. Now you can see it. 44% are school staff members, and 35% are mental health professionals. And now you can see results. And for the next question, my input has been welcomed and valued by my local school district administration in making decisions. So it looks like we've got a tie, yes and no, somewhat. And 66% have voted at this point.
You know, and Dr. Perez, I think when people feel like they have input into decisions, even if everything they've said isn't necessarily considered or the outcome isn't exactly what they've wanted, they just want to make sure they had a voice. And a lot of schools have provided that through conducting surveys or maybe Zoom meetings, but listening is critically important at this difficult time.
So one of the biggest percentages here, somewhat, and I'll show results now. 38% have said somewhat. So as you can imagine, it's quite a process. And let's go into our third question. My family and I have coped well with the COVID-19 pandemic. You know, as I was typing that question, I was wondering, have I coped well?
Yes, and you know, this is, Dr. Perez, really a time when self-care is needed. And, you know, I'd like to think that many of our families feel more connected, more empathetic. They maintain traditions or even started new ones. But I think I'd be naive to think that the quarantine went well in all of our families. But the majority are indicating yes, they and their family have coped well. And I try to remember to begin every conversation with somebody I haven't seen for a long time with simply asking, how are you doing? Are you safe? Are your loved ones safe? How have you been coping? And I really think that's important in our schools. I hope all these staff members, when they return to school, either virtually or physically, felt like the administration began with, how are you doing? Has somebody in your family been ill? I hope you have not lost a loved one to this virus. So I
And let
think
me
those
just
polls,
and share the results for you. And my colleague Anthony Munarega is joined us. And Anthony, can you see the poll results there?
I can, absolutely. So, and real quick, Dr. Poland, I think a good question came through is, and you explained it a little bit, and that was about coping well. What else? I mean, how would you essentially define well? Is it 100% perfect? Am I 50%? How would you describe that?
great question, Anthony. And generally, I believe this is a time when we should lower the bar. Lower the bar for student academic expectations, lower the bar for us as teachers, as parents. To be honest, everybody has lost it at some time during this pandemic as it continues to drag out and there's no end in sight. So coping well would basically be getting at least reasonable amounts of sleep, managing stress in ways that work for you, but recognize that the virus has impacted all of us. And sadly, with the death of now, I believe, over 212,000 Americans, many individuals lost loved ones to that virus. So coping well would be, I'm able to go to work, I'm civil with my family, I'm able to at least learn at a reasonable level. If I'm a student, and you know, our teachers right now, and I had a number of them in my class just last night, they're doing extraordinary things and teaching virtually and teaching some students that are physically in the classroom with them all at the same time. And some teachers just commented on, it's exhausting, and wearing that mask every moment of the day, it's difficult. But in my opinion, it really needs to be done. And I did one of these webinars for a school district, and they would not let me say masks are required. And I found that pretty frustrating, since we know that that mask is really, it's a defense. It helps keep us safe and other people safe. It's almost like we learned to wear a seatbelt. We didn't like it in the beginning, but those masks are really important. So why don't I move on, and I will be showing some slides and getting to some critical things that I'd like to say today. And again, thank everybody for tuning in. So bottom line is, as I stated a moment ago, this has gone on a long time. Lots of kids have missed out on a lot, not only last spring, but they simply haven't been able to learn as well virtually as in the classroom. So lots of stress and anxiety really for all of us. Now, what about these decisions to reopen our schools physically, which is having kids and teachers back on campuses? Largely left to local authorities, with the key determinant being, what's the virus transmission rate in your local community? Lots of polls have indicated parents are thinking about other options. As many as 40% of parents considering homeschooling their children, and indications that about 1 in 4 children have not returned to their local public schools. They're either being homeschooled or they went to smaller private schools. And here locally, right here in Broward County, there was some data saying that now that schools have reopened physically, only about 20% of students have physically gone back to their school campus. And I wish I could say today that the Center for Disease Control has told us not to worry about children. They can't contract the virus. but they can contract it and they can pass it along to other people. This has meant that parents have been faced with incredibly difficult decisions. Do they continue the virtual instruction for their child, or do they send them back physically? That has been very perplexing, difficult decision for children. Some schools have received criticism. I imagine many of you can immediately conjure up the image a few weeks ago of that crowded high school classroom in Georgia, hundreds of kids, nobody wearing a mask, everybody trying to make their way down the hallway. Schools have also struggled with, what do we do when a staff member or a student tests positive? And frankly, this is going to happen in every single school in America. At least a few staff and students will test positive. And what do you do at that point? Do you isolate an entire classroom? Do you isolate just the few students that were the closest to the person that transmitted and caught the virus? What do we communicate with parents? What do we put on the dashboard for our school today? Those are the issues. By the way, you know, a superintendent in New York said, as in a moment, I'm going to go through the ABCDs, but he said, I can't do all of these. All of these are not possible. How do I decide which one of these safety recommendations are the greatest priority? My response, have a task force of staff members, teachers, help them determine what is the greatest safety priority for our school. And I already mentioned, unfortunately, masks have been politicized. And I'm going to try to keep politics out of the conversation today. I think we all need to focus on what it is that we can control, but we're a very diverse country. And in a lot of locations, masks are not being worn. So what are the choices that parents have? So all virtual or the hybrid model. Some school districts are doing something like this. There's the A group. They go Monday, Tuesday. There's the B group. They go Thursday, Friday. And what do they do on that middle day, Wednesday? That's a deep cleaning day. And then some schools are having kids back 5 days a week. And we've got hundreds of participants today, but as far as I can tell, in trying to research this carefully, at least all school districts are offering some form of virtual learning, at least for the foreseeable future. And then parents, some parents are hiring their own homeschool teacher, or parents are doing it themselves, trying to balance all the issues of working at home and teaching your kids school. And I believe strongly in our families. The older kids learning virtually should help their younger siblings, and everybody should be rewarded for that. We have a daughter who's a teacher. My advice to her was, you must set a limit. You must say to those second grade parents, 6 p.m., I'm off duty. I'll respond to your emails and texts tomorrow. But if you can't reach me before 6 o'clock, I have to have some time for my family and for myself. And then some parents are getting together with other families and essentially creating their own homeschool pod. So there's a lot of creativity about trying to figure out what to do. And if you've been on any of these webinars with me previously, my CALM model, that C can stand for so many other things. What can you control? Hopefully, there's been a lot of communication from your school, from your administration to school staff, to parents, and to students. We should always be there to listen. An administrator needs to listen to their staff members and parents. Parents need to listen to their children. In fact, the simplest way to start a conversation with the kid is to ask, What do you know about the virus? What's on your mind? And to acknowledge it's unprecedented. We don't have all the answers. We're going to try to figure it out, and we're going to work on this together in making the best decisions about what we as a family and a school can control. On the M, we really need all the adults, whether they be staff members, community mental health, parents. We need to all be modeling optimism and hope for the future. And you know, in the hallway, there is a sign that says, life is a struggle, but there will be a future. Life's been a struggle now for more than 7 months, and it continues. And I already talked a little bit about the management in our homes, but parents have to monitor carefully their child's behavior, not only for looking for symptoms of the virus, but here's the bottom line. School's ability to stay open will depend on responsibility from students and from staff. A lot of my career has been spent responding to school violence and trying to prevent it. And I've always say, school safety is an inside job. So trying to prevent the spread of the virus in school is also an inside job. It involves responsibility on the part of all concerned. And I'm sad to tell you that there have been a number of stories about parents who knew their kid tested positive and they still sent them to school. If I had the ability to do it, I'd like to have all parents sign off. I will not send my kid to school when they're sick. I'll check their temperature every single morning. And if they arrive at school and get sick later, I will do everything possible to pick them up quickly. And I noticed that we had a small number of administrators sign on today, but collaboration and communication, making yourself available to staff, parents, and students, listening and valuing all of that input. And then when school resumed, whether it was virtual or physical, model optimism and hope. But don't be afraid to share a few things about some of your frustrations, challenges, and worries. I know that at an international school in Europe, a school counselor shared with me, first day back, the big administrative meeting, it's like the principal acted like the virus never occurred. The virus is on everybody's mind, and that's where we need to start as we try to figure out how to help everybody feel safer. I hope everybody will just take a moment now, take a couple of deep breaths, let them out slowly, and say to yourself, we will get through this in our family and in our school. And self-care plans are critically important for everybody. A self-care plan isn't selfish. It's about taking care of you so you can do your best to help others. And we need to simply acknowledge kids are going to look to the nearest adult to see how upset to be about this continuing pandemic. And as a parent, once you weighed all of your options, you gathered all the information you possibly could, and you made a decision about whether your 7th grader is back on the school campus or not. Once you've made that decision, stick with it. Don't beat yourself up about it. You went through a very detailed process to make the best decision you possibly could. So these are all the things that we all know, all the things that we need to be doing. But at least in my neighborhood, I see some relaxing about avoiding large gatherings. And we need to follow these CDC recommendations. These are things we can all control. These are things our children can understand. So what are these ABCDs? Wear a mask when inside somewhere besides your own home. And when you can't physically distance outside, also wear a mask. But nobody ever said you can't go outside and you can't do it safely. Because getting out there in that Florida sunshine today, taking a walk, riding a bike, gardening, those are things that help all of us. And we all need to know the warning signs, the symptoms, and stay home when we are not feeling well. And schools need, of course, a lot of extensive cleaning. That's why some schools have an entire day where nobody comes so they can do that deep cleaning. And kids need to understand what's a 6-foot distance and the importance of staying away physically from others. So the real question I'd ask every single one of you is, how well did you do with those ABCDs? How have you been able to overcome some of the challenges in your home? Or if you're a school teacher, how have you been able to cope with all the demands that are placed on you? And one principal said, I know I have one staff member, they're very afraid to come back. What can I do? Have a one-on-one conversation with them and simply ask them, what would help you feel safer? What else can we do? And schools need a go-to person, kind of like the COVID manager, that's going to keep track of not only safety protocols, but steps taken when somebody does test positive. Kids' reactions to traumatic events, which has really been my entire career, responding to crises in schools. Kids regress academically, they regress behaviorally. They have nightmares, sleeping problems, worries about the future. And I'd like to ask each of you, try to do your best to get the proper amount of rest, because when we are rested, we can deal with things so much better. And who might be the most at risk? What do we actually need to know right now? We need to know which kids, which students lost a loved one to the virus. We need to know which students have a mom or a dad that lost their job. Which kids are worried about their family being able to keep their home or pay their apartment rent. And I said in the beginning that I hope that families pulled together and everybody felt more connected after being quarantined together. But that'd be really naive on my part. Child abuse has undoubtedly gone up. And by the way, where is most child abuse reported? It's reported at school. We've had kids not in school for many months. So that child abuse largely went unreported. Domestic violence is undoubtedly up. Alcohol, drug consumption is up. Even the number of guns purchased is up. And my concern is always, are those guns secured so that a child in that home cannot possibly get their hands on that gun? So there are a lot of related issues that have gone up. As a crisis responder, primarily, I just listen. But when appropriate, I asked this question. I'm going to ask it of every single person on our webinar today. Who or what has helped you during this pandemic? Who or what has helped you in the past when you've had to deal with sad, traumatic, and difficult things? The most common response: family, friends, faith, self-care. We need to always remind people of what has supported them through difficult times before. It's something that I've said to Parkland parents over and over, something that I truly believe. When a kid lives in a stable home, when they're shown unconditional love every day, every way by their parents, they can overcome almost anything. But you're immediately thinking, a lot of kids don't live in a stable home. Unfortunately, not every kid is shown that unconditional love by their parents. And how do you actually help kids and students the most? You help their teachers, you help their parents first, Then they understand those typical reactions, and they're simply in a better position to be patient, structured, tolerant, and loving with kids. I have often found schools to underestimate the impact of a tragedy. And I'd also like to say, it is not too late to provide staff and students the opportunity to talk about what the pandemic has been like for them. I'd like to think every wise administrator did this on the very first staff training day. I'd like to think every teacher did this in the very first class virtually a month or so ago. But if you didn't do it then, it's still not too late. And I'm sorry to report, youth suicides have almost always increased after traumatic events. Here's a teachable moment lesson plan that we developed. And the idea is in a classroom with proper physical distancing, kids have a chance to talk. They know the facts. They know the safety precautions. They get to talk about what that quarantine was like for them, what they might be worried about now. And hopefully they learn to express empathy for the people most affected by the virus. So find those times, whether it's in a classroom or in a family, to make sure kids are truly heard about their thoughts about the virus. I do a lot of speaking and a lot of training about youth suicide prevention. The bottom line, it's the second leading cause of death for everybody over the age of 10. That's the 2018 figures prior to the pandemic. So what kids might be most at risk now? Those with untreated and undertreated mental illness before the pandemic. Those that lost a loved one to the virus. Those that might be living in poverty for the very first time. Schools need procedures and plans. Everybody needs to know what to look for. Don't keep a secret about a student exhibiting suicidal behaviors. Get the school counselor, school psychologist involved. Make sure parents are notified. Secure community services. So I've pretty well covered these questions, with the exception of how well did students actually do virtually? And in an ideal world, teachers would have the same kids this fall they had last spring. That would solve all the communication issues about who did well and who didn't do well. A lot of teachers are in my graduate classes, and some of them were pretty frustrated by the number of kids that were virtually never online. About some parents that said, stop calling me about their academics. This virus has really made us all aware some kids have a lot. They have virtually everything they need. Some kids don't. Some kids don't have the devices. And even if schools were able to get them the technology devices, they didn't have good, consistent internet access. All of those things have impacted kids' learning. What's the biggest fear now that schools in South Florida have reopened physically? Fear of catching the virus is the primary concern for staff members, for kids, for parents. The second concern is kids missed a lot last spring. They are significantly behind academically. This is especially a problem at the secondary level. I wish our schools had thought at the high school level, what about pass-fail for the first grading period? Take off some of the academic pressure. Lower the bar. I've been given some examples where teachers increased the academic expectations during the virtual learning in the spring. Some kids did quite well with virtual learning, but a lot of kids didn't. But something I know about teachers, they have always been very skilled in helping kids recover lost concepts. all kids regressed at least a little bit academically over the summer. Well, now we had a much larger period of time. So very important to meet kids where they're at. We shouldn't be thinking, oh, now, even though he's 14, he must have a learning disability. No, he just had a lot of difficulty learning virtually. Communicate with the teachers in the spring. Find out what these kids missed that are now in your classroom. Be patient. They will catch up, but it is going to take a significant amount of time. And some kids are going to catch up a lot faster than others. So how could we identify the real struggling students now that we're in the fall of 2020? By the way, you know what I would argue? The mental health needs of the kids in our schools right now may be the greatest in modern times. But unfortunately, I'm not aware of schools given more resources to increase school counselors, social workers, and school psychologists. That would have been the ideal thing, to recognize all the mental health issues. But we may have kids that are making hopeless statements, kids that are frustrated, kids that start talking about death and dying. We're going to have kids that are having a lot of concentration issues. They're withdrawing. They appear sad. And just yesterday, in talking with a second grade teacher, I emphasized, you've got to find out what the first grade teachers say. Were they seeing those same behaviors last spring, or is this something that is new? And parents have commented about some of their children with OCD tendencies. It's like they spend a big part of the day in hand washing rituals, and it's driving everybody in the family crazy, and mental health assistance is needed. Or parents of children with autism have had very specific questions, and my response has been, you need to get with the special education personnel and the school psychologists at your child's school, because they know them the best and share your concerns about the behaviors your child is exhibiting. So what's the CDC telling us about children and COVID-19? Well, for the most part, they've been catching it from a family member. Their symptoms, thankfully, are less severe, but they can carry the virus to vulnerable adults. Thankfully, not many children have died as a result of the virus, but some have. And those kids that have complex medical conditions, we need to be the most concerned about them. And pay attention to that transmission rate in your community. Center for Disease Control gave us a decision tree to try to decide about kids returning physically to a school campus. Parents need to be looking at how well did their child do with virtual learning? How did they manage that isolation of only being able to see friends through social media and through the Zoom class meetings? Is anyone in your family compromised medically? Because that is a very significant factor in whether you're going to send your children physically back to school. Then we've got to look at the risks, and we've got to look at the benefits. Having worked in schools full-time for 26 years, what do I know? For some families, the daycare before school starts is important. For some families, it's the extended daycare after school. Some kids get their breakfast and they get their lunch at school. And when they're home, they might not get one or both of those meals. And for some kids, extracurricular participation is incredibly important in terms of something that gives them a great sense of accomplishment and identity. Schools vary a lot though, because in the Midwest, they've been playing high school football for months. In South Florida, we haven't even quite started yet. So again, the disparity in decisions that have been made around the country, and hopefully those decisions have all been made based on the recommendation from local, state, and national health officials. And another question is your school able to follow most and hopefully all of the recommended safety guidelines? Now back to the issue of virtual learning for a moment. First and very important question, is there an adult in the home who can at least spend some time trying to make sure learning is actually taking place? And does your kid have the devices and the internet access, and they have been at least reasonably successful with the virtual learning and are not suffering too much from the lack of social connections? So schools are trying a lot of different things in terms of small numbers of students coming back, students being kept in small groups virtually most of the day, less changing of classes, maintaining the physical distancing, improving ventilation in classrooms, opening windows, having some classes outside if at all possible. Those are all the things that schools are doing. And I think schools are doing extraordinary things to try to make the most out of a difficult situation. This will be on my last slide, but I think this statement fits here. We don't have data. We have never encountered anything like this before. So it's not like we have data to guide schools in our decision making. And schools are trying to balance the educational needs of students with health and safety, but they don't have all the tools and all the resources that they need. So I said earlier, schools being able to stay open is largely going to depend on student responsibility. So earlier in my career, I made safety pledges to try to prevent school violence. So now I did one about COVID-19. Some school districts are implementing it, and feel free to change the wording if that's helpful to you, put your school letterhead on it. But the bottom line is our students need to take it seriously and follow all those ABCDs, and especially stay home if they're ill. And parents need to keep their kids home if they're ill and come to get them promptly if they develop symptoms at school. So trying to make this as concrete and understandable as possible for everyone. Hopefully, all of our schools will be able to stay open. But all we have to do is look at undergraduates when fall semester started. A lot of schools closed for several weeks. Some went virtual for the rest of the semester because when they brought undergraduate students back physically to campuses, they gathered in large numbers and the virus spread. So what does this actually mean? This means K-12 student responsibility is not just during the school day when somebody's watching them. It needs to extend to evening, weekends, all aspects of their life. That's why parents need to pay attention. Parents need to be modeling the right behavior and ensuring that their children are responsible as well. So we've been talking about the risks and benefits to school reopening physically. We talked about the CDC decision tree to try to guide parents in making this very difficult decision. But once it's made, be positive about it and accept it, and recognize you're always going to have some conflicting thoughts about maybe I should have decided something else, but don't beat yourself up about it. You went through a very complicated process, made the best decision you could at the time with the information you had available. We need to all be alert for the signs of stress, of being on edge, sleeping problems, concentration problems, irritability, changes in appetite, energy, and activity, and be very alert to someone in your family or your school making statements about hopelessness and life not being worth living. How can everybody manage all of this? A self-care plan. Remember, you can choose how you respond to this virus. There are certain things you can control, which is your reaction and following the ABCDs. And one of the prevailing psychological strategies is stay in the moment. What do I mean by that? Do not worry about things that have not even happened yet. Stay busy. And I know I speak for Dr. Perez and I don't know that we've ever been busier since this pandemic. And he's put on countless webinars by now, maybe like 50 of them. Staying busy helps all of us. And make sure you are that positive person for others. And you seek out the people in your life that are positive and encouraging to you. And when we talk to kids about this, mostly it's listen, find out where they are, what do they know, what are they worried about. We can't make it go away. And it's hard not to have all the answers about when we'll have a vaccine, when we'll have a treatment. But we can say the smartest scientists in the world are working on this. Tremendous global resources are going towards finding a vaccine for this virus. Yes, it is contagious, but thankfully, the vast majority of the people who catch the virus have only minor symptoms and they recover. So there's the ABCDs again. Ask children what would help you feel safer. Try to avoid criticizing our state and national leaders. Concentrate instead on what we can control and what we can do. And recognize we've got a lot of heroic people in the medical profession. We need to thank them. We have a lot of heroic teachers too. They came back to school during a pandemic, and many of them have very big concerns about being able to stay safe, stay healthy, and keep doing what they love, which is teaching children. And we need to all admire those teachers that are back in schools. We already talked about the typical reaction children have to a traumatic event. There's a little more information about how they respond by ages. And I don't want to belabor those points because I want to allow some time for your questions today, but I want to also quickly talk about self-care. This is the normal cycle of stress. This is before a pandemic. So obviously, stress has significantly increased. The self-care plan isn't selfish. It's about taking care of you so you can care for the people in your life. Physically, it's diet, exercise, and proper rest. Mentally, it's attending to your emotions, giving yourself permission to make mistakes. Don't engage in a lot of self-criticism. Lower the bar. And if you lost it with one of your loved ones, simply apologize and say, I'm going to work on handling things better in the future. Express your thoughts and emotions through journaling, painting, drawing, gardening, other creative activities. My partner discovered paint by numbers, and they are really relieving stress and have produced some really incredible paintings. So find that creative activity that will help you. And when I talk about spiritual self-care, I'm not just talking about places of worship, because certainly that's very important for many of us. But there's also just this set of values that are critically important. Are we compassionate, empathetic, friendly, helpful, kind, respectful of everyone? Do we do those things? And maybe we even find a little humor when we can. And by the way, nobody should have ever told us, don't go outside. Going outside is one of the things that helps us. And I did one of these webinars about summer planning for kids. Okay, theme park, not a great idea, but going camping, an isolated campsite, very, very healthy, and you're outdoors and you can embrace nature and just model being positive to others. And these I can statements are critically important. I can get enough rest by doing the following. I can exercise by doing these things. I can be good to myself and others in these ways. Those are incredibly important. You may be sitting there thinking, okay, but I teach first or second grade. How can I cover self-care with 6 and 7-year-olds? Get out the poster board. They draw a picture of themselves in the middle. And then around the circle, they draw pictures of themselves exercising, helping others, being happy, eating the right things. And some of you might have heard of this class. Dr. Santos has the most popular class in Yale University history. And by the way, it's online and it's free. You'll find it at the Happiness Lab website there on the bottom of this page. So what's she really saying? You know what makes us happy? It's just chit chat with people. Talk to our gardener. Talk to the guy making your coffee at Starbucks. Talk to the neighbor. But we haven't been doing as much of that. We've been kind of avoiding, keeping our distance from other people. But we need to try to increase our social connections. Then she said, time is precious. Don't let technology consume you. You know, a year ago, I would have said this to you. Don't let technology steal your children. Okay, but technology has become incredibly important to all of us for social connections. But then here's the good news. Teenagers are not really addicted to technology. They're addicted to each other. But Dr. Santos makes this point. Turn off the phone. Too often, we're with our loved one. Everybody's on their phone or on their apps. Turn them off. Talk to each other. Embrace the moment and really connect with your friends and family. She also says, we have this idea that self-care would be this beautiful bubble bath. She says it's wrong. You know what is really important for our self-care? Just doing nice things for other people. Engaging in acts of kindness. Send somebody a positive text. Surprise somebody with something, a surprise gift delivered by Amazon. We need to show gratitude for all of the positive things that do remain in our lives. She also said, don't run away from negative emotions. I like her acronym RAIN. Recognize, accept, investigate, and nurture. We all have had negative emotions. I'm not the only person that occasionally wakes up at 4 a.m. in the morning and can't go back to sleep. So we need to allow ourselves to experience some of these emotions, but to constantly be saying, I can manage this. I will, we will, as a family and a school, we will get through this pandemic. Those schools that had careful plans that were based on lots of input from staff, parents, and students, I believe their plans are going to be a lot more successful this fall. There's no way to know absolutely what was the right or wrong decision about sending your kid physically back to school. Let's be honest, even our physicians can't give us a guarantee. There's no activity outside of our home that is without at least a minimal risk. But once we've made that decision, accept it. And I believe strongly, the school's ability to stay open will depend on responsible behavior from staff and students. And I know our daughter, who's a second grade teacher, is working very hard. And many teachers are doing extraordinary things. They're a new wave of heroes. And I hope you thank a teacher for everything they are doing in unprecedented, challenging times. And I'm always going to be saying schools need more resources. They need a second nurse. They need a second clinic. They need smaller classes. They need more mental health professionals to deal with unprecedented times. Here are the resources that I used today, and I'm going to turn it back over to Dr. Perez, or Anthony, actually, to see what questions somebody might have today.
Yes, absolutely. Dr. Poland, thank you so much, first and foremost. That was a lot of great information that we are getting quite a few questions this afternoon. We do have, of course, teachers, but we also have school psychologists, Dr. Poland, that are in attendance. And so the question you mentioned how, and no doubt teachers, a new wave of heroes, they have to, you mentioned recovering the lost concepts, meet students, children where they're at. How about school psychologists? How can school psychologists get involved? What's their part in all this as well?
School psychologists, Anthony, are really skilled in helping kids recover academic losses, helping kids figure out best ways to learn. And I know a number of school psychologists have been concerned that all of a sudden they'll be flooded with referrals to special education. That's why I said earlier, the answer isn't referring kids for evaluation. The answer is working with teachers, students, and parents to help them recover some of these lost academic skills. And maybe most of all, a school psychologist can help all the adults understand the typical reactions children have to trauma. Just be patient, structured, tolerant, and loving. And school psychologists are key personnel to help kids that might be exhibiting signs of depression. And I hope teachers let school psychologists and counselors know it was this kid whose beloved grandma died from the virus. It's this kid whose dad's out of work and they're not sure how they're going to pay the bills, and are they going to be able to stay in their house, so that we can utilize all school and community resources to support those kids that are suffering the most from losses, whether it be of loved ones or financial ones.
Great. Our next question, Dr. Poland, it's a good one. It shares Florida news outlets have reported that state funding for e-learning is only set to run for the first semester, and the state has not committed to providing funding for the second semester. Thus, some school districts have said they may not be able to offer e-learning after winter break. So how can educators help to ease anxiety of parents, staff, and other teachers who are afraid of being forced to return in person?
Wow. Well, so much of this really needs to be discussed individually with the person who's afraid. Self-care plans will help, as well as feeling like their input was really valued about what would help the school be safer. And here's the bottom line. And I don't know that You know, we want to acknowledge this, but the school funding in the South is significantly less than the school funding in the Northeast part of our country. Florida, before the pandemic, needed to fund schools better. And all I can say is every staff member, every parent needs to have their voice heard. And they need to do that through voting, through contacting state and national legislative representatives, because there is not indication that this virus is going to magically go away by the beginning of the spring semester. So obviously, I hope schools and families, students, teachers, everybody needs options until this virus is controlled.
Absolutely. And curious, Dr. Poland, you know, with that answer, I would imagine that the same sort of advice that you provided, explanation, will go for with I guess tempers running high right now. You know, eh, with Florida reopening schools, sort of however we want to label it, like kind of this fast running quickly with the phasing of reopening, and so therefore attitudes are going to clash and beliefs are going to clash. You know, I get, would you perhaps answer this the same way if let's say a group will come to you and be like, Dr. Poland, what are the resources that I can use, because they're rushing me. I'm being rushed into this, into going back into the classroom right now. What do I do?
Okay, another great question. And you know what I really hope is that school administrators are meeting regularly and have been meeting for months with school staff and welcoming their input. We do know schools, especially in South Florida, they got pressured by the Commissioner of Education in terms of reopening a little faster than they had thought. And I just believe we need to all be listening to the health officials locally, at the state level, and nationally. We're in obviously uncharted waters. Everybody wishes it made sense for all kids to be back in school every day. We all want to get back to the way things used to be, but progress towards that will be slow, and we need to make wise decisions based on science.
Absolutely. And so to a teacher, Dr. Poland, what would you suggest in that re-engaging of students remotely? Since, you know, since a lot of, you know, students are still virtual, what would you suggest in re-engaging the students remotely, but also supporting them with identifying any mental wellness support that they may need?
Well, another great question. And one of the things I think helps is to be online before class starts, stay online after class is over, so kids have a chance to talk to you one-on-one. And I know here at the university, with our new incoming students, I was assigned a number of them. I called them, I talked to them. I had a Zoom meeting before our fall semester even started. One of my favorite examples is Katie's mom is a fifth grade teacher. So Katie's mom got on the Zoom call. And so I felt like I not only connected with Katie, our new student, I connected with her mom. Now I know school has started already, but teachers have pretty good ideas about who's not doing well. Try to find the time for those individual calls or Zoom meetings to reach out to that kid and that family. That is really important. One other possibility to get an idea of how kids are doing is allow some free writing about the quarantine and the pandemic, because some kids will share a lot with you in writing that maybe they won't do verbally. So an activity like that would help us get a sense of how have kids really done? How are they coping at this moment? What do they need?
Right. Absolutely. And so what do you believe then will be the long-term social skills impact, if any, due to quarantine, isolation, virtual learning?
Well, I know some people have talked about, they've used terms that I would never use, like a lost generation. I don't agree with that at all. I know that kids are resilient, kids that are surrounded by loving and caring family and friends, kids that are optimistic about the future, kids with problem solving skills, kids that have a chance to vent strong emotions, they can bounce back from almost anything. With caring adults in their life, at school and at home, I'm very optimistic. I don't think we're going to have a lost generation. We may need to increase things like the availability of tutoring, the availability of summer school, all things that would involve increased funding, but I believe it will be needed. But I am very optimistic about kids in school and basically recovering academically and socially.
And sort of kind of going into outside of teachers, Dr. Poland, let's say into school nurses. Um, if a child comes to the school nurse frequently with anxiety and just wants to go home, I mean, what's the best answer? What's the approach to that?
Well, I'm glad you brought up school nurses because having worked with and known many of them, school nurses are extraordinary individuals.
Mhm.
Some of them have shared with me that they don't always feel a part of a team. And we need to make that school nurse a part of a team. If they've got a kid with somatic complaints, a kid who doesn't want to be at school, wants to go home, that nurse needs to have conferences with teachers, administrators, counselors, parents. It's almost like at the simplest level, we need to increase what I would call the circle of care around a kid, which is all the adults working together to support them through whatever it is that is happening.
Absolutely, and kind of going back to that circle of care, that's great. And the circle of care, along with you highlighted it, the CDC, I guess tree of virtual learning, um, you know, re- accessibility, right? Reliable devices, reliable internet, etc. But let's throw in area in the house. Private room may not be available. Living room table probably is, but parents are working there too. Is that a good sort of learning area? How about Dr. Poland, children or a child who is sick, but those parents can't take time away from work, risk of losing their jobs, lack of resources. What about those sort of concerns in the child's learning?
Well, you mentioned so many important things, Anthony, but a proper workspace is really important. There have been some great features around the country where carpenters are getting materials and building desks and just giving them away because kids need them. Okay. Then the other thing you made me think of, I had this conversation yesterday. It's like, okay, if I am in charge of a number of employees in my company, hopefully I know which of my employees have kids at home, which employees are trying to do their work from home, but also help their kids learn reasonably virtually. Hopefully, I give that employee a little bit of a break. Maybe I expect you, because I know you don't have any kids at home, maybe I expect a little more productivity from you than I do from another employee who's got 3 kids in elementary school. So maybe I know which of my employees doesn't have a partner. They're doing it by themselves. Which employee doesn't have a mom who can like move in or come in during the day and help. So this virus has affected everybody in so many ways, But if we just get back to compassion, empathy, understanding about what people have gone through and what they are still facing. So when we're compassionate, I think we make good decisions about the people in our family, our friends, our employees, our students. In fact, it was a school psychologist that shared this with me, and I love this. She said, we have to respond with grace and compassion to the needs of our students. And I think that might be a way to just close today's webinar. Hopefully everybody will remember, every kid is somebody's son or daughter. Every kid deserves our very best. Some kids have a lot of support. Some kids have a really difficult time. We need to recognize that and respond with grace and compassion to every need a child or student has.
Absolutely. Great. Dr. Poland, thank you so much. Wonderful, wonderful piece of advice, wonderful information. We truly appreciate your time. And to all our attendees, as mentioned already on the chat, but we will be, since this presentation is being recorded, it will be posted on our website. So you could take a look at it, take a look at the presentation again, especially those who are interested in Dr. Poland's great slides, as I'm sure a lot of you do. So again, this presentation will be uploaded to our website in a couple of days. So please check back with us as you want to revisit this. But before going, I do want to acknowledge also that this webinar, this presentation is being presented by NSU's College of Psychology. And the NSU's College of Psychology, especially within the Department of Clinical and School Psychology, where Dr. Poland teaches in, the college offers an array of undergraduate and graduate degrees. Graduate degrees anywhere from experimental, forensic, general psychology, counseling, our APA accredited programs in clinical and school psychology, and our specialist degree in school psychology as well. Our programs are offered in a variety of formats, from online to hybrid to right here on our Fort Lauderdale Davie campus. And again, we ask that you please visit us at psychology.nova.edu for any information on these great programs. Also, if you'd like to read a little bit more on Dr. Poland's background and his expertise, we definitely invite all of you to please visit our website. Again, psychology.nova.edu. I want to again just emphasize many thanks and appreciation to you, Dr. Poland, for joining us this afternoon. Your insights are absolutely astounding, and it is a pleasure to always just talk to you, walking in and out of the building, running to you in the parking lots, visiting your office, but also just applaud you for your remarkable work that you do within our community. NSU has 8 values, and you live every one of them, but one that stands out, in my opinion, is community. Every time I hear community, I think of Scott Poland. So Dr. Poland, thank you very much for doing this afternoon.
Thank you, Anthony. And we will make the PowerPoint available, the safety pledge, the teachable moment lesson plan. I know that you always send out, I think it's like a thank you to everyone. So yes, we'll make those things available.
Great, thank you. Ladies and gentlemen, thank you again for joining us. Please be safe. On behalf of Nova Southeastern University and the College of Psychology, take care of yourself and each other. Thank you very much.